Thanks everyone for coming. I'm Dave Wilson, the Johnson County, Iowa Emergency Management Agency Director. We're going to have the first press conference for the Johnson County 2019 COVID-19 response to the outbreak. And we have a number of people that will be speaking today. Kelly Andreessen's our lead public information officer for Johnson County. Dave Coach with Johnson County Public Health and some others will be up here, as well as the University of Iowa Hospitals and Clinics and the University of Iowa. So you have to excuse my voice. I'm a little bit raspy from talking on the phone so much today. And we'll get going and we'll get underway. They're going to have some prepared comments, and then after everyone's prepared comments, we'll go ahead and take questions from the media. So I'll turn it over to Kelly.
Good afternoon. I'm Kelly Andreessen, lead public information officer for Johnson County. As Dave mentioned, we do have several individuals who will be speaking at the press conference. And that will be followed by Q&A. Just one quick housekeeping note. We are recording this so that it can be shared as widely as possible. So if you do have a question, please raise your hand, give your name, who you're representing, and then state your question. We do have Jack from Iowa City Channel 4 who will have a microphone, and he will bring it to you so that we can actually hear your question on the audio so that the response makes sense. As Dave mentioned, we do have representatives from University of Iowa Hospital and Clinics and Mercy, Iowa City, and then members from our Johnson County Sheriff's Office and our Public Health Director, Dave Coach. I will pass it on to Dave. Please hold your questions until everyone has spoken, and then like I said, we'll open it up for a question and answer session.
Thank you, Kelly. As Kelly said, my name is Dave Coach. Last name is spelled K-O-C-H, Director of Johnson County Public Health. Good afternoon, and thank you for being here. I want to assure you that the staff at Johnson County Public Health are working with the Iowa Department of Public Health, the State Hygienic Laboratory, the University of Iowa Hospitals and Clinics, Mercy, Iowa City, local school districts, and other public and private partners to both contain the spread of COVID-19 and mitigate its potential impact. We appreciate the expertise and assistance of these partners, and several of them are here today to be able to speak and answer questions. For the general public who are unlikely to be exposed to the virus at this time, the immediate health risk of COVID-19 is low. I do want to reiterate that the health risk is very low. Individual risk of this virus is dependent upon the exposure. This includes travelers returning from the affected international locations where community spread is occurring, including Italy, Japan, South Korea, China, and Iran. These locations are updated by CDC and can be found on their website. The Iowa Department of Public Health has requested Iowans returning from a country where COVID-19 is spreading to voluntarily self-isolate for 14 days following their return. If you have recently been to an area with ongoing spread of COVID-19 or have been exposed to someone that is sick with this virus in the last 14 days, you may face some limitations on your movement and activity. Johnson County Public Health will specifically contact those who test positive for the virus and those who have had close contact with those individuals. Please follow the directions at this time, as your cooperation is integral to the ongoing public health response to slow down the spread of this virus and to protect those most at risk. Currently, there are 7 positive cases of COVID-19 in Johnson County. All 7 of those cases are with the travelers on the cruise ship that visited Egypt. IDPH provides updates on persons being monitored, tested, and the test results every Monday, Wednesday, and Friday afternoons. Those results can be found on their webpage. Everyone can do their part to help respond to this emerging public health threat. Everyday prevention methods are very important. What we've been talking about, what you've been hearing, washing your hands, staying home when you're sick, covering your cough, limiting the contact with your face, all of those things that we've been teaching our kids for years, all of those things, prevention items that we talk about every year for influenza, are the same messaging that we want to get across today. Some people are at higher risk of getting very sick from this illness. This includes older adults and those with underlying conditions or those who are immunocompromised. Infection among children is relatively uncommon, and children with COVID-19 have generally presented with mild symptoms. Preparation is key. Individuals and communities should prepare for COVID-19. Please see IDPH's targeted recommendations for schools, businesses, long-term care facilities, and all these are on their website. You can also call 211 with any questions that you may have. If you develop COVID-19 symptoms, contact your local healthcare provider, tell them about your symptoms, and most importantly, your travel and exposure to a COVID-19 patient before you go to the clinic or the office. Symptoms of COVID-19 include fever, cough, shortness of breath. Again, be assured that Johnson County Public Health is in constant contact with the Iowa Department of Public Health and our local healthcare providers, and we are dedicated to containing the spread of COVID-19 and mitigating its potential impact. As always, make sure to wash your hands, cover your cough and sneezes, avoid touching your face, and stay home if you are sick. So at this time, I just want to turn this over now to Dr. Brennan with University of Iowa Hospitals and Clinics.
So my name is Teresa Brennan, Brennan. I'm the Chief Medical Officer at the University of Iowa Hospitals and Clinics. My remarks will be fairly short today, but we'll be happy to take questions after. So we appreciate the partnership with the Johnson County Public Health Department as well as the Iowa Department of Public Health in addressing and effectively treating patients through this outbreak. Our message today is that we, as the University of Iowa Hospitals and Clinics, are blessed to have a team that's ready to take care of patients and also to keep our visitors, our staff, our other patients safe. I would reiterate the comments made earlier about hand washing. Be certain that you're washing your hands. Do it for the required length of time, 20 seconds. Use hand hygiene gel if hand washing is not readily available. Cover your mouth and or use your sleeve if you're sick. Stay home if you're sick, and don't touch your face. Most importantly, as Dave said, if you feel that you have one of these infections or an influenza-like illness, very important that you call your healthcare provider before showing up. That allows us to direct you to the appropriate place so that you can get the best treatment, as well as contain any infection that you might be carrying. Thanks for your time.
Thank you, Dr. Brennan. We'll now pass it over to Margaret Reese with Mercy, Iowa City.
Thank you and good afternoon. I am here today in the capacity of Public Information Officer for Mercy, Iowa City. And as has been described by the individuals prior to me, the cases of COVID-19 that have been confirmed in Johnson County have been thoroughly described. The information has been provided by the Department of Public Health and suggests that these are all travel-related cases. But what we want you to know is that Mercy, Iowa City is prepared for the possibility of more widespread transmission in our communities in southeast Iowa. Mercy has been preparing diligently over the past several months for this situation. We have implemented our emergency response plans and are prepared to care for confirmed and suspected COVID-19 cases. We are working very closely with our public health officials in Johnson County and the state of Iowa, and our community partners, such as the University of Iowa Hospitals and Clinics and the VA Hospital, to ensure that we are following the appropriate protocols and policies, and we appreciate the confidence our patients and community have shown in Mercy to care for them with compassion and expertise. And the best source of information regarding the instances of COVID-19 in Johnson County are with the Johnson County Department of Public Health. So I certainly encourage you to look to them for the most detailed information. Thank you.
We'll now open it up for questions. As I said, if you do have a question, please raise your hand, and we will come around with the microphone. State your name, your affiliation, and then your question.
Hi, my name's Michaela Ram. I'm a reporter for the Cedar Rapids Gazette. Are you guys able to talk about these Johnson County cases, whether or not there was interaction with the public before they tested positive for this?
So the individuals that were presumptive positive, when they first came here, they did not have those symptoms, and so all of the exposure that they had, there was no one at risk in the community when they were out in the community before they were presumptive positives. So I want to reiterate the fact that the risk is extremely low, that they are not actively contagious when they do not have symptoms, when they are asymptomatic. And so I do want to assure the community and the public that although they were in the community and continue to be in the community, they're not symptomatic, and so therefore they are not risking the general public's health.
Taylor Vessel with KWWL up in Waterloo. Can you speak to any of the people that they might have had contact with, whether it's a close immediate family member? Are any of them being monitored? Are any of them been tested?
Yes, it's a great question, and that's part of the work of local public health. So we have 2 disease prevention specialists internally. We also have staff from Iowa Department of Public Health that is doing the contact tracing and the surveillance work. So we are in communication with all of those individuals that have had close contact, that are in voluntary home confinement or are self-monitoring. So what that means, self-monitoring twice a day, they're taking their temperature and reporting that to our staff. And so yes, we are in constant, that's part of our routine surveillance investigation on any communicable disease. So this is extremely well known for us. We do this every day with different types of diseases. There are approximately 50 communicable diseases in Iowa that our staff do tracking, tracing, contact tracing, and those types of things.
Just to confirm, none of them have been officially tested for COVID-19.
No, some of those individuals have been tested.
Okay.
The results are not back yet. Some of those are pending, and those, I want to reiterate as well that this is, as you've heard around the country, this is emerging quickly. Every hour, every day, we're learning more, and our contact list is growing, and so it's a very rapidly evolving situation. So. There are tests pending. I can confirm that.
Do you have a number offhand?
Those numbers are on the state's website as well, the pending test.
I think there were 11. Do you know an exact number of how many in Johnson County are within that pending?
I do not have that information.
Okay.
Mary Green with KCRG. For the folks who are on the cruise in Egypt, what the public's been told, including here today, is that if you're traveling to those 5 countries that are on the CDC's travel advisory list, to let the state know and to do the 14-day self isolation. That being said, these folks went to a country that is not on that list. They came back, they tested positive. You have a large university, a lot of students will be traveling for spring break. Folks who are traveling in general coming up here, any advisories or recommendations you're giving them right now?
It's a great question, and we're taking the guidance as well from Iowa Department of Public Health, and they're monitoring that. Part of the investigation process that we have and the forms that we fill out when we do those investigations with individuals is ask on travel history. So that's all part of that process, and that does pose a question as far as with spring break coming up, and certainly there's schools, universities putting their own recommendations in place as well, and they can speak to those.
I'm not representing the university per se. I can tell you that lots of conversations are happening about travel and whether we should advise. We as well are following the CDC and the Iowa Department of Public Health recommendations. So at this time, we don't have any new recommendations. I will say reiterate what Dave just said, is that these things are changing very rapidly, and so within hours things could be different.
Hi, Michaela with the Cedar Rapids Gazette. Are you putting out any advisories at this point regarding large public gatherings? I've seen a number of events locally being canceled due to these concerns. Do you have any guidance related to those events?
So we are not putting out any guidance or recommendations at this point. A lot of businesses and organizations are doing that on their own according to their own policies and protocols. However, there's no recommendations at this time coming from local or state public health regarding that.
That to change anytime soon?
Well, I think if you monitor around the country and other states, when that messaging changes and pivots is when they have community transmission. We have not had any community transmission in Johnson County or the state of Iowa. That may change in the future, and when that changes or when we have evidence of community transmission, then the messaging may change as well.
I can speak to, so the University of Iowa, we are looking, University of Iowa hospitals and clinics are looking at every event that is scheduled that is elective, and really looking at the people that are invited or expected to attend. So if they are predominantly older patients that would likely attend, we are considering canceling because they're elective and they can be postponed. Just for concern that we do see this in Johnson County, and there could be community transmission in the future.
Just to follow up on that, Dave Wilson with Emergency Management, we've received a number of questions about community events related to that. We think it's always a good idea to have a plan B on whether your community event, as Dave Coach stated with public health, if this is rapidly evolving, if those guidances change, then people need to have a plan B on if you would postpone that to a different date, say it's a whatever community event. So we encourage them to have an alternate plan. But right now, the message is clear. We've not got any community transmission. We don't have any guidance for them to cancel any community events. But people need to be reasonable.
Using the philosophy that an abundance of caution is not necessarily a bad thing, at Mercy we are being very cautious. We are restricting visitors. We are screening visitors to the hospital as of last evening, just to be careful, and asking groups that typically meet at Mercy from the outside to postpone for a while, and we will reassess in April and get back to them. The health and safety of our patients and our colleagues and all visitors to the hospital is the most important thing, so we are just being very cautious and making sure that we are restricting the number of people who visit Mercy and making sure that they are in good health when they do so.
Hi, I'm Hillary Ojeda from the Iowa City Press Citizen. There was a news release that said that all of the cases were in recovery and at home in isolation. Could you give an update on the condition of the cases in Johnson County and how they're doing?
I can share what I know as far as those cases, that they are home, they are recovering, and we have no indication that the illnesses have gotten any more severe of those individuals that have tested positive. Does that answer your question?
Mary Green with KCRG again. Earlier, Grinnell College announced that after spring break, it's keeping its students at home, finishing out the semester with online classes. Dr. Brennan, I know you said that you don't speak for the University of Iowa. That being said, from any of you, really, because I know you talk about constant communication with all these groups, are there any talks right now to do the same at the University of Iowa?
Of course, conversations are being had. As a Board of Regents institution, we'll follow the recommendations of the Board of Regents. Just in the abundance of caution, we're of course having those conversations.
Do we have any additional questions?
Shannon Mowdy with Iowa's News Now out of Cedar Rapids. Talking about that self-isolation, how stringent is that self-isolation? What kind of monitoring is being done to make sure those people who need to be home are home?
That's a great question. And the individuals that are self-monitoring or voluntary home confinement have been extremely cooperative. We have not had any concerns about them violating those orders. What those orders mean really is that they are to stay in their homes if they're under voluntary home confinement. And that is per Iowa code. There is Iowa code that allows local or state health departments to enforce that. We have not had to go down that road at all as far as enforcing, because they are voluntarily cooperating and being very diligent. They understand the importance of those orders. As far as the self-monitoring orders, those individuals, like I said earlier, do call in twice, text or call in twice a day to our disease prevention specialists for 14 days when they're during that restricted period. At that time, they're not 100% restricted to their homes. They show no symptoms. They can go outside for a walk. They can do those types of things. They are not to go on like mass transit or airplanes or anywhere where it's heavily congested with individuals.
Hi, Rin Swan with the Daily Iowan. Currently, there's a lot of confusion surrounding where people go to get tested. So what does the testing process look like for those who suspect they may have contracted the virus through community spread, and how long will it take to get results?
So the question is about confusion related to where to go to get tested. Closer. My name is Jorge Salinas, Jorgesalinas. So the University of Iowa has multiple options for patients to be treated. Testing is just part of medical care. If somebody needs medical attention, depending on the severity of the illness, we have a number of options. We're working on telehealth options. We're working, we also have quick cares, urgent cares, our emergency department. We have an entire tower of clinics at the Iowa River Landing where patients can be seen as well. If there is if patients are already established in our system, they can call their providers and we can arrange for them to be tested. But if any member of the public has any questions about testing, they can call the University of Iowa hospitals and clinics, and we'll arrange for testing.
Well, I think that's important, and I might rely on you, Dr. Brennan. But as far as those individuals that are self-monitoring, they are, part of the orders are very clear. So if they develop symptoms, they are first to call the 800 number for IDPH and consult with them. Then Iowa Department of Public Health will call the local ambulance service to be able to notify them. But even before that happens, you know, they're gone through certain criteria and questions to make sure that testing is appropriate. And then if that is the case and they need transport, then that would all be coordinated through Iowa Department of Public Health. As far as if you want to speak to that.
So some of the patients who are affected have been tested in various places. I think Mercy did some testing over the weekend. We did some home testing. We actually have a clinic now where patients can just come in for testing at the discretion of the Iowa Department of Public Health. The turnaround time is about 4 to 6 hours. It depends on what time the test gets to them, but for sure within the day we will know results.
Hi, I'm Hillary Ojeda from the Press Citizen again. There was a Board of Regents release today. It indicates that the board is asking the 3 regent institutions to move as quickly as possible towards the ability to deliver instruction virtually. Is there someone we could talk to about how that's supposed to look, or if that's going to happen?
Here to our PIO, do you?
That should be the university. I think
Okay.
Yeah.
Any additional questions?
Just one last question. I'm not sure if you can speak on this. Will the State Hygienic Lab be ramping up testing capabilities? Last number we heard was that there are 500 testing kits. Will there be more on the way?
I know they're continually ordering. I don't know the numbers they have available. I can tell you as well that various institutions are working toward getting the tests in their own hospitals, and we are doing the same.
Shannon Mowdy with Iowa's News Now. These are presumptive cases that the CDC has to confirm. How long does that process take for the CDC to confirm, and what does that process look like?
I don't think we have an. I don't think we have an answer. The Iowa Department of Public Health would be best capable of answering that question.
Hi, Rin Swan from the Daily Iowan again. So this goes back to a question that was asked earlier about spring break. So for international students on campus who may be traveling abroad, what precautions are currently being set in place for when they return?
I think those types of questions would relate to University of Iowa. They don't have a representative here. Are probably best directed to the University of Iowa's Public Information Officer. I know they're trying to develop that guidance presently with the University of Iowa staff and the Board of Regents, so I would direct that question to them.
There's active conversations going on. We've been focusing on the hospital, so I'd hate to give you wrong information.
And if you'd like, when the press conference is over, I can connect you to someone at the University of Iowa who you can reach out to.
That'd be great, thank you.
Okay, seeing no further questions, we will wrap things up. If there are future press conferences, we will send out a media advisory, and so you will be aware of them in advance. Thank you.
Thanks everyone for coming out. Again, I think our public health message that we're trying to convey and the reason we wanted to get everyone together here today is just to reassure the public, instill a sense of calm, and instill a sense of those general public health measures that you use or should be using every flu season are the most effective. When you're sick, stay home. Follow up with your personal care physician. Wash your hands. Clean contact surfaces. The things that we should be doing every flu season are the things that are most effective. So if you help us convey that message of calm and reassurance to the public, I think that would be greatly appreciated. Thanks for coming, and we'll let you know tomorrow morning if there will be another media avail, and we'll get that out to you. Thanks again.
Thank you.